This is Cynthia Schwenke, and this is my persuasive speech, How Important is Your Life? This is my audience. Many people in this country view assisted suicides as a dignified, controlled, simple way to die. It is a way to guarantee a smooth, easy passing. Euthanasia is not mercy killing, it's just plain murder. It truly devalues one's life. But to fully explore this topic, we must first define euthanasia. Euthanasia is defined by the Merriam-Webster's Dictionary as an act or practicing of killing or permitting the death of hopelessly sick or injured individuals in a relatively painless way for reasons of mercy. This is much like putting an animal down. A method of death is put into place and the person dies. Sometimes this method is as simple as an overdose. Doctors purposely prescribe more of a medicine to a patient. The patient then ingests the deadly cocktail of pills and they die of a drug overdose. In other situations, the patient is introduced to said overdose intravenously. They fall into a deep sleep and never wake up. Some people, however, choose a different path. Dr. Jack Kevorkian assisted over 130 people with their suicides. He used death machines. One such instrument was a gas mask rigged up to a carbon monoxide tank. The individual would literally breathe his last breath of harmful gas before he slipped off to death. The very last thing one would experience would be the replacement of life-saving oxygen with death-inducing carbon monoxide. What would convince a person that a drug or poison-induced death is better than a full life? Lots of suicidal people want to end their lives. Perhaps they're depressed about their health or finances. So what kind of suicidal people do physicians administer the good death to? Patients who are terminally ill are the usual candidates. Someone who has lost the will to live due to an incurable disease. People believe since their own lives now have an expiration date, they don't need to continue living the way that they do. With many life-threatening diseases, there is terrible pain. Some think that death is the only way to alleviate that pain. Patients also decide they don't want to burden their families or their friends. Long-term care is a reality for diseases such as multiple sclerosis or ALS, commonly referred to as Lou Gehrig's disease. These diseases complicate and eventually hinder the movement of muscles. Dr. Kevorkian defended his acts of assisted suicide by saying he encouraged his patients to seek out additional medical advice on their conditions. He also mandated that a patient see a psychiatrist as well as a pain control specialist. But someone with severe depression could feel like they've given up their will to live. They've done all they can to advance their lives, but have had little to no luck. Is it that their quality of life is non-existent, or that they've just simply given up on trying to do better? We as a society reach out to people that attempt or even talk about attempting suicide. There are hotlines, institutions, and programs for people to talk with others about their situations and try to get help. But along come organizations like the Hemlock Society that believe when a person is fed up with their life, a doctor can help them end their existence. We used to believe in fighting for one another's life, not fighting to help end each other's lives. There are many pro-death groups that are trying to legalize this form of murder. But should assisted suicide be legal? According to the state of Oregon, yes, it should. On November 8, 1994, Oregon became the first state in the U.S. to legalize physician-assisted suicide. This gave doctors the legal right to kill people. The law was intended for terminally ill patients with 6 months or less to live. It seemed flawless. However, many of the states documented assisted suicides are people that suffer from severe depression. Their first case was a woman in her mid-80s. She spent 20 years battling breast cancer. She asked her personal doctor to help her commit suicide, and he refused. She sought the help of the second physician who diagnosed her with depression. He too refused the request. She eventually got together with a suicide advocate group who set her up with a doctor that agreed to do the lethal injection. This doctor had only known her 2.5 weeks. If the law states that only terminally ill patients with less than 6 months to live may receive assisted suicide, why was this severely depressed woman allowed to die by an unfamiliar doctor's hand? There have been several proposals made before the 1994 Measure 16 in Oregon was passed. There was a proposal in 1988 in California to attempt to legalize physician-assisted suicide. The pro-suicide advocates could not acquire enough signatures to qualify this initiative for the ballot. In the next two proposals, one in 1991 for Washington State and the other in 1992 for California, the initial polls conveyed over 70% support. When the ballot came out, however, they had a 54 to 46% loss. It's pretty obvious that the majority of people do not agree with assisted suicide. This legalization would most certainly lead to abuse. Who do you feel has the right to decide when you die? With assisted suicide legalized, who's to say that a doctor couldn't just end one's life when he felt it was necessary? Why would a physician knowingly end a person's life that shouldn't be ended? One reason may involve malpractice. In California, early 1995, a 9-year-old multiple sclerosis patient was admitted to the University of California Medical Center for a realignment of her jaw. The surgery went well, and she had to have her jaw wired shut. She became very nauseated after the surgery. The doctors didn't remove the wiring from her mouth in time. The vomit filled her lungs, making it impossible for the girl to breathe. The young girl suffered brain damage and fell into a coma as a result. A doctor convinced her mother to take her off life support. The mother agreed, but the strong little girl started breathing on her own. After this miracle, the hospital decided not to continue to supply the life-saving nutrition the girl needed. The comatose child was then cut off from food and water. One of the doctors went to this young girl and injected her with potassium chloride. The chemical paralyzed the child's heart, and she died. What a way to go for a physician to cover up a mistake. And who was the physician to determine it was time for a 9-year-old girl to die? The legalization of assisted suicide would also give doctors the right to determine when they're wasting valuable resources on a patient. Dr. Marcia Angel, Executive Director of the New England Journal of Medicine, proposed to pass laws that prohibit medical care for the unconscious after a passage of a specified period of time. This means that a physician could remove a feeding tube supplying vital nutrients after a certain period of time. The time period would be established, so the decision wouldn't be personal. When did the ultimate decision become a choice for a doctor? We would often trust the advice of family members concerning death. But what happens when our family members view us as burdens? In Myra Leibov's case, her family certainly didn't have her best interest in mind. Myra had multiple sclerosis and was disabled. She committed suicide on July 4, 1995, with the help of her husband, George Delury. When the news broke about Leibov's death and her husband was quickly charged with her murder. The Hemlock Society set up a defense fund to try to alleviate his legal fees. The media portrayed Delury as a loving husband that helped his courageous wife die with dignity. Thanks to the Jewish weekly Forward, the country began to see Delury as the monster he really was. He had actually convinced his wife to stop her disability payments and receive a $50,000 lump sum. She asked him not to cash the check, but he did. Beverly Sloan, Myra's sister, recalled her sister as full of life even in the months before her death. Then the case was rocked by the discovery of George Delury's personal journal. It was an intimate account of how he had actually been the one who wanted his wife to die. He researched her medications. He found that her antidepressant medication would indeed kill her if mixed properly. He didn't just kill her physically, he murdered her emotionally. He told her, "I have work to do, people to see, places to travel, but no one asks about my needs." As his wife started to feel better about her situation, he became more infuriated. He wrote in his diary, "Sheer hell. Myra is more or less euphoric. She spoke of writing a book today. She's interested in everything, wants everything explained, and believes every bit of bad news has some way out. It's all too much. I'm not going to come out of this one with one piece with my honor. I'm so tired of it all. Maybe I should kill myself." For his cruel and heinous act, Deliri served 4 months in jail. After his release, he turned his personal journal into a book called "So What If She Wants to Die?" Beverly maintains that Deliri coerced her sister into suicide. Even though assisted suicide is legal, George Deliri was barely punished. Myra Leibov was a writer and editor and beloved sister, and her life was taken from her by her own husband. If assisted suicide is legalized, any family member that feels burdened could help end someone else's life. All in all, the legalization of assisted suicide would cheapen the value of life. It would allow just about anyone to decide the fate of the ill, depressed, or socially outcast. The decision to choose death is solely up to the individual. A physician's job is to ensure the patient receives all the treatments possible. If there are no other treatments possible, comfort is then their job. Through counseling, pain management, and therapy, many terminally ill patients come to terms with their disease and overcome their struggles. It all comes down to value, the value of one's life. So, how much is your life worth?